Hi, everyone. My name is Angela Colpart from Revitalize Functional Medicine. I am a nurse practitioner, and today we're covering some of the top questions that women ask about progesterone and how to know if it's right for you. If there's one hormone women should know more about, it's this one. Progesterone is one of the body's major female sex hormones, and it plays two big roles: reproduction and regulation. In women who ovulate, progesterone rises after ovulation and prepares the body for a possible pregnancy. Its main biological job is to maintain a pregnancy in those early weeks. If pregnancy does not occur, progesterone levels fall, and that drop is what triggers our menstrual period. But progesterone is more than just a fertility hormone. It's what we like to call the happy hormone because it activates GABA, a neurotransmitter in the brain that helps reduce anxiety and improve sleep. Progesterone also works to balance estrogen. Without enough progesterone, estrogen's effects become too strong, which can lead to a variety of symptoms. People love to talk about estrogen dominance, but in my opinion, not enough people talk about the real issue: low progesterone. Progesterone is what we like to call your happy hormone. So without it, many women have symptoms of too much estrogen and can feel mentally and physically imbalanced. We can, of course, test for low progesterone through blood work. This would be done during the luteal phase, which is the window between ovulation and your next period. But honestly, most women recognize low progesterone just through symptoms alone. Some of the biggest signs that I see in my clinical practice are trouble falling or staying asleep, more anxiety or irritability, especially in the second half of your cycle, headaches related to those changes in pain perception and neuroinflammation, breast tenderness, spotting before your period, or having shorter cycles, heavier periods, severe cramping, PMS that feels stronger than it used to. Think mood swings, breast tenderness, or bloating, difficulty getting or staying pregnant, hot flashes, night sweats, and an overall on edge, overstimulated, or being very easily overwhelmed. If we're targeting a young woman that needs progesterone replacement, we are trying to build up that luteal phase, that progesterone that rises right after ovulation, preparing for pregnancy, and with a drop once it finds you're not pregnant. That deficiency in that phase will lead to those heavy periods and cramping and moodiness. So, progesterone for this type of woman will help to alleviate those symptoms, regulate cycles, and make periods the way they were intended to be. Now, for a perimenopausal woman, now that is a woman who is creeping towards menopause. Hormones are shifting. That progesterone is one of the first hormones to really leave. That estrogen is still staying high and at times going even higher. So we have this roller coaster of estrogen where you feel those estrogen dominant symptoms. But instead of paying attention to the high estrogen, we should be looking at that progesterone who is no longer really supporting the body. So you're feeling all those really high effects. In this case, I recommend taking progesterone every night unless you are still having a regular cycle. That progesterone is going to help alleviate some of the symptoms that your roller coaster of estrogen is making you experience, like breast tenderness or irritability or depression or anxiety, really heavy bleeding, and make that transition into menopause much easier. And then once you are in menopause, meaning you are no longer making really any of your hormones, we're looking to replace your estrogen. If you have a uterus, we must also give you progesterone. Even if you don't have a uterus, it's my recommendation we replace your progesterone as well because of all the benefits we've talked about. Progesterone will not only protect your uterus and endometrial lining when we give you that estrogen, but it's going to help you sleep. It's going to help balance your moods. It helps to protect your breast tissue. There are so many progesterone receptors in our body, and a progesterone deficiency can lead to many other concerns. Let's clear up one of the biggest hormone misconceptions. Bioidentical progesterone is not the same thing as synthetic progestin, commonly found in things like birth control. Bioidentical progesterone is chemically identical to the hormones in your ovaries that are naturally made. Your body recognizes it, responds to it, and metabolizes it the same way you would with your own progesterone. Synthetic progestins The kind used in many birth control pills, injections, and some IUDs are completely different molecules. They were designed to prevent pregnancy, not to mimic natural progesterone. Bioidentical progesterone, which we use, doesn't act like that. It supports your natural biology, helping to activate GABA for better sleep, calming anxiety, balancing estrogen, supporting brain, bones, breast tissue. So, when we talk about bioidentical progesterone, we're talking about replacing what your body is designed to use, not giving it a synthetic alternative with different side effects.